All right, what you're gonna do for checkoff is you're going to do trach suction and trach care. We're gonna do trach suction first and then trach care. Why do you think you would suction before you clean it up? It's gonna make a mess, and you wouldn't wanna clean and then suction, cause then you're gonna have to clean again. So you're always going to suction first. So I'm gonna go in my patient's room, I'm gonna introduce myself. Hey, my name's Brooke, I'm gonna be your nurse today. We're gonna be doing some trach care, we're gonna suction, and then we're gonna get it all cleaned up. I'm gonna ask them their name, date of birth, if they have any allergies, the things you're always gonna do. I'm going to get a set of vital signs, and I'm going to get a pulse ox if they're not hooked up to a pulse ox. I'm gonna take one with me, and I'm gonna put it on her finger, and it's gonna stay on her finger the whole time so I can monitor her oxygenation, okay? In your room, you need to make sure you have an ambu bag. We've got it, and it's hooked up to her oxygen. You also need to make sure you have a suction set up and a suction canister. So we've got all that. You also need like a towel or some kind of pad that you can put over the patient's chest, because we know this is a procedure where we can get messy, and we're gonna try to keep the patient as clean as possible, okay? Also, before we start, we're going to do a respiratory assessment. We're gonna listen to her with our stethoscope because we want to see what her lungs sound like, so we have a baseline. So when we get done and we listen, we can see if she sounds better, okay? I think that's all before we start. So I'm gonna come over. Drew, this is your kit. Thank you for letting me use it. If you don't have, it did not have saline, so I've got saline, and we will have that for you at your checkoff, so you don't have to worry about that for the suction part. All right, so I'm going to come over and I'm going to open up my suction, and notice my sterile gloves are on top because this is a sterile procedure. Now we're pretending these are sterile. Okay. I'm not gonna touch my skin, I'm just touching the gloves. All right, remember when you get your sterile gloves on, keep your hands above your waist, okay? So this stuff in here is sterile. This is your little basin. We're gonna set it right here. And here is your suction catheter. I'm going to take this suction catheter, and I'm right-handed, so I'm gonna kind of curl this up in my right hand, okay? Just so it's not flopping around, and so I don't risk touching anything with it. Okay, my non-dominant hand, which is my left hand, I'm gonna come over here, and I'm going to get my suction. Wherever it is. And I'm gonna connect my suction catheter, and all you do is you're just gonna push it on like that, okay? So now, I've got my suction catheter in my sterile hand, my non-dominant hand. I've got to hyperoxygenate my patient. So, I'm gonna take this ambu bag, and I'm gonna give the patient 5 breaths. 1, 2, 3, 4, 5. All right. We've hyperoxygenated our patient. I'm gonna come over here. I'm going to dip this down in my, oh, let me tell you that. My dirty hand, because this is not sterile, I'm gonna come over here and I'm gonna pour my sterile saline or sterile water down in there. I'm gonna come over here. I'm gonna dip that down there and lubricate it and make sure the suction's working, okay? I'm gonna roll it back. I'm gonna come over here. Now, I'm gonna take the tip of my catheter. You're gonna go down the tracheostomy. You're gonna go down until the patient starts coughing or you meet resistance, okay? So I'm right there and say my patient starts coughing, coughing, coughing. So at the same time, this left hand, my thumb, is going to go on top of that hole intermittently. Never put your thumb on there and hold that to continue a suction. Intermittently, my finger's gonna go like that, and at the same time, I'm gonna, in a circular motion, twirl that catheter and pull it out slowly. Okay? You should never suction more than 10 to 15 seconds, okay? Because when you're in there, you're taking away their air. That's their airway, okay? So no more than 10 to 15 seconds. For checkoff purposes, y'all only have to go down one time. So if y'all will tell us, hey, my patient sounds much better, she's not coughing up any secretions anymore, the suction went well, you can be done. But in real life, if your patient needed suctioning again, you can go down a total of 3 times. And each time you would have to hyperoxygenate their patient in between, okay? But for checkoff purposes, you'll only have to do it once, okay? So we've pulled the catheter out, she sounds good, she sounds clear. I'm gonna get all the nasty stuff out of here. I'm gonna roll this up. I'm gonna put my gloves. I'm gonna take this dirty hand right here and just go ahead and pull out this dirty dressing, okay? And throw it away. All right. That's all with trach suctioning. Does anybody have any questions about that part? All right, that's the easier part to me.
If you have to do it more than once, do you get a whole new kit every time, or you can use the same thing?
Mm-hmm.
So even if you touch the part
Well, you're not
that's
gonna
inside
touch anything, like it's gonna go down in there, but then you're gonna keep it in your hand.
It's still sterile.
It's still, I mean, it's obviously it's been down
It's
them,
rough.
but yeah, no, you can use the same one. You don't have to open up a whole new kit. Okay, so we've done our suction. So then you're gonna move into your trach care. All right, how do I open my kit?
Away from
Away from me, so it's gonna go away from me. And notice my sterile gloves are on top. Okay, hands are above my waist. Trash. Okay, now we're gonna set up our sterile field. Remember doing that last semester? How should I touch this? Should I touch this like this? 1 inch border. So, and as I open it up, am I doing this and letting it fall on the table? No. All right, shiny side, does that go up or down?
down.
Okay, and notice my hands didn't touch the table when I put it down, okay? So, everything in here is sterile. Do I wanna put my stuff like right there? Mm-mm, we don't want it, because remember, we've got that 1 inch border we're trying to stay away from, okay? So remember, try to keep your stuff in the middle. All right, I'm going to take my saline. I'm gonna put saline in all 3 compartments, okay? And then notice, look, I'm not going like this, I'm going around your sterile field. Don't ever lean over your sterile field, drag everything across it, always go around, okay? In the video that you'll watch, the lady takes her 4x4s and she makes little wontons. You do not have to make wontons for checkoff. You can do them however you want to. I like to just fold mine like that. And I'm gonna place it down in my saline. That is my, the clean one that goes at the end. So we're gonna leave that to the side. That's our trach ties we're gonna leave to the side. And I'm gonna leave 1 4x4 to dry with, so I'm gonna leave that there. I'm gonna put my little Q-tip looking things and my brush down in this saline compartment. These I'm gonna leave right there. All right, my sterile field is set up, I'm ready to go. So I'm going to come over here. I am right-handed, so with my non-dominant hand, this is gonna be my dirty hand, okay? So I'm gonna come over here and I'm going to, I'll show you these when I pull it out, but I'm going to undo, I'm gonna pinch the sides of these things and pull out this inner cannula. see the, little clips on the side? If y'all just pinch those, it'll undo from the trach and you just pull it right out, okay? So I've undone my trach. I'm gonna come over here and I'm gonna put it down in this little compartment right here with this sterile water. Okay, I'm gonna take, I've got a sterile hand, I'm gonna come over here with my brush. I'm going to go down this way. I'm going to, if I can get it to go in this way. Notice I'm not doing this over my sterile field, okay? I'm over here. All right, so I've cleaned that off. I'm gonna trash. These pipe cleaners, I don't know if your kits will have these or not, they look like pipe cleaners. They're to dry, so like you can go down, trash. I can take one and go this way, trash. If you don't have pipe cleaners, you can just tap it to get the excess water off, okay? Then I'm gonna come back. I'm gonna go back. I'm gonna pinch the little clips on the side and it goes down, okay? My sterile hand, I'm coming over here. I'm getting one of my Q-tip looking things that's in my saline. These are to clean the stoma. The skin underneath around the trach site is the stoma. I'm gonna take this, I'm gonna go underneath this plate against the skin and I'm gonna wipe away. I'm gonna trash. I'm gonna go on the bottom and wipe away, trash. If I needed to use another one, I could. I'm going to take one of my 4x4s that's in saline and I'm gonna clean the plate part. So I'm gonna go up top and wipe on the plate, trash. I'm gonna come down here on the bottom, trash. And remember I saved a 4x4 over here. This is a dry one. So I'm gonna use this one. Say I've got a lot of saline on my trach. I'm gonna take my dry one and I can just blot around just to dry up any extra water. Okay, so now that is cleaned. Now I'm gonna take my dressing. See how this dressing has a V in it? Don't ever get a 4x4 and cut it with scissors. Because if you do, those little fibers can unwind and it can go down in their trach, and that's not good. So these will always come pre-cut for you, okay? So never make one yourself. You will have these in the hospital or the nursing home or wherever you are. So there's no way I can get this dressing up underneath there with one hand. So at this point, we're done cleaning the inside and all around the skin. I can use this hand to help me get it up underneath. But your dirty hand should never touch the V part, okay? Because the V part is what we're trying to keep the most sterile because that's what's going up against their skin. So I'm gonna come over here and I'm gonna use that dirty hand to lift up this side and I'm gonna do that. And then I'm going to do it on this side and just pull up like that. It'll just slide right underneath. You also have in your kit a tie, like for a new dress, a new ties. You do not have to do these for checkoff, but we will ask you how to do it. So how you would change your ties, you would undo one side like this, pull your tie out, you would slide that one through and tie it, then you would go around the back of the neck and come around to this side, undo that side, and then tie it. The main thing we want you to know is you would never undo both sides at the same time. Why would you not do that? Yes, if she starts coughing, if she sneezes, if she turns, that can shoot out and then you're gonna be in trouble. So, never undo both sides at the same time. So the main thing to remember, undo one side, tie it, go around, undo the other side, tie it, okay? But in the hospital, you're gonna have these fancy Velcro ones. You're not really gonna see these a lot, okay? And in the hospital nowadays, respiratory does a lot of your trach care. A lot of times your patient, if they have a trach, they're gonna be on oxygen. So you're not gonna have to use an ambu bag. They might have a trach collar on. They might be on the ventilator. You could just hit 100% on the ventilator to oxygenate them. A lot of times in the hospital, they're not gonna have an inner cannula. Like this is actually a disposable inner cannula. So like, in real life, if you have one like this comes out and you throw it away, you open up a package, get a brand new one and put it in. So this is not actually the kind that you take out and clean, but we want to show you how to do that because patients that have long-term trachs, patients that come from home with trachs, patients that are in the nursing home sometimes, they might have the type where you have to take the inner cannula out, clean it and put it in, and you should do that sterilely. But my whole point is nowadays it's a lot easier when you're in the hospital doing trach care, but we're just trying to show you what you would do if you had to, okay? Any questions?
Do you have to hyperventilate before you do the care?
Well, in real life, notice that her oxygen's off.
Right.
So you're doing this as quick as you can.
Okay, right.
So I'm just going slow to
Right,
show you how to
understand.
do the steps, but in real life, you're gonna suction and you're gonna hurry and clean and be
okay,
done.
got it.
But remember, I've got a pulse ox on her finger right here, so I'm watching her oxygenation. So if she starts dropping or she looks like she's in distress,
Right.
stop, give her oxygen back, let her rest for a few minutes.
Right, okay.
Any other questions?
Would you still hyperventilate somebody that's like on COPD and has the, what's it called? The like drive for breathing, that you're not supposed to give them like 100%
If you're
oxygen?
doing trach care, I mean, you can ask your doctor, but I would imagine yes, because when you go to do